is a process of creating collective organizational commitment of quality improvement, organizational analysis and self-assessment, strategic formulation of the organizational developmental planning, human resource development, teamwork and service systems focusing on patient-oriented mindedness.
So today we have with us Dr. Shubhangi, and she's one of the earlier members. And she trusted us and she had joined our quantum also, and she is a guiding star in the field of gynecology and doctors also. She has hospitals in Amravati and 3 hospitals she's running. She comes from a family of doctors. Very nice hospital they are running in Amravati. More than that, she is a very enthusiastic lady. She is always ready to learn new things, and you cannot count on what her age is. But she is really as enthusiastic as any newcomer or a new person in the new doctor in the market. So, welcome Shubhangi ma'am, and
Hello.
delighted to have your understanding and learnings, and from your experience we learn a lot. Yes ma'am.
सबको नमस्ते. मैंने ये चांस लिया बोलने का क्योंकि I love the academy. मैं family जैसी. So I'll begin with a thank you and end with a thank you. And this thank you is a special thank you to Dr. Trainer Academy and the duo, Dr. Pranav and Dr. Amit. You have guided us so much and encouraged us so much. It's for our benefit that you are encouraging us. It's like that. So thank you so much. So today I'll be talking on importance of quality in healthcare. Actually, Dr. Pranav said that I should be talking on NABH, means I volunteered that I will talk on NABH. I wanted to have a topic which is common for all faculty doctors, not only for gynecologists. Usually I give speeches in gynecological subjects, but I wanted to talk on quality because I joined the academy because I wanted something different and I couldn't find the way. So I joined the academy, and gradually I am learning also, trying to apply also in my hospital management work and loving it also. So I chose this topic. So now these are just the formal slides. With each slide we'll talk. I'll share my difficulties or my experiences. So what is a quality? Quality is the consistent delivery of a product or service according to expected standard. So this was the thing. What are the expected standards from us? We never knew. We are not taught in our school, our colleges, medical curriculum, that what are the expected standards from us. And we when I entered the academy, I realized that we have to form our SOPs, our own SOPs, and set our own expected standards. Standards are expected from everyone, from patients, from our staff, from the community, from the government, and from us. There are actually, we can ignore everyone, but not us. So there are 3 things which are involved: customers, employees, and the managers that interact in the provision of healthcare. So centrally there is a customer satisfaction and patient safety. That is the center of the quality control or quality management in the hospitals. And for this goal, employees, managers are working as a team. These are the formal definitions. According to ISO, quality is defined as the degree to which a set of inherent characteristics fulfills requirements. It is both objective and subjective. And according to WHO, quality of care is the level of attainment of health systems' intrinsic goals for health improvement and responsiveness to legitimate expectations of the population. TQM is total quality management. So in hospitals and healthcare organization, doing it right every time requires that everyone in the organization is aware of the need for total quality management and is equipped with it. We are not aware that there should be total quality management, and for that we need to equip our staff, our right from building. Actually, we need to equip our building accordingly, equipments, then our staff and other technical support, and we ourselves also keep on updating ourselves. So that is the need of the time, and I wanted to share this with you all. That's why I am talking of more of quality than of NABH. This involves that the personnel are qualified and have necessary knowledge, skills, and aptitude. Knowledge, when we are learning, we get the knowledge. And as doctors, we also try to acquire all the skills. I remember till 2016, I was updating myself only. At our times in medical colleges, in the gynec department, there was no laparoscopy training, there was no test tube baby training like that. So till 2016, I was updating myself and acquiring, going, attending so many, what you will say, trainings. And I was updating myself, but I was not aware of updating the hospital also. I would buy a lot of instruments, but maybe I didn't maintain. So that was till 2016. Then all of a sudden in 2016, IMA came up with the NABH this thing, accreditation process. And then when I went through that NABH accreditation process details, and one thick book was given to us by that accreditation process personnel or the company who helped us in accreditation. When I went through that, I understood what is quality. So total quality management is also a part of hospital management. And if we aim for total quality management, then only like we can reach some goal, and we can have an opportunity to compete with the benchmarks in the hospital organizations. But for that, we need lot of skill development and attitude development also, especially in our staff as well as higher management. So leadership is also very important, and till now we all are usually running individual hospitals, or maybe we are in the group practice, but we are the leaders and we should lead the organization. We should dream of a TQM or a highly qualified service delivery, high quality standards in our service delivery, and then only we can develop. And that's why I like Doctorpreneur Academy, because if you go through the vault, all the recordings in the vault, they are training us at each and every step of the management, each and every step of quality control. So if we really take it sincerely, we can deliver a very good healthcare organization, healthcare services, and it will give us satisfaction to us, more to us than to others. And for that, I really praise Doctorpreneur Academy and the two pillars of the academy, Amit and Pranav. They had a real vision. It helped them, but more to us than to them.
Thank you so much.
So the key concepts of total quality management are strong customer orientation. I don't mind talking of a small experience, or maybe the mistake I did. I am a very home type of person, and I would make my patients wait so much unless I finish. In Marathi, there is a story I'll try to tell in Hindi that one sparrow was there. एक चिड़िया रहती है, उसके यहाँ एक दिन कौवा आता है और दरवाजे पे नॉक करता है। तो वो बोलती है कि मैं अभी दरवाजा खोल नहीं सकती क्योंकि अभी मैं मेरे बच्चे को नहला रही हूँ, अभी मैं खिला रही हूँ, अभी नहीं खोल सकती, अभी मैं उसको सुला रही हूँ। सो अपॉर्चुनिटी नॉक्स एट योर डोर, बट देन इट्स you have lot of excuses. It's that way. So I behaved this way with the patients. That was the biggest mistake I made, I suppose. So I want to confess here, so that at least those who are not, those who are doing all this will take some, I don't want to advise anyone, but take it as a pinch of salt. And you have to define your quality policies and objectives. Yes, we work accordingly. Everything is defined, but we don't note it. Documentation is so important. We don't write everything, but if we write, then it becomes easy for us to remember. It becomes easy to train the staff, and even if we change the policy, we ourselves can understand that what improvement we have done. So for that thing, this word is very important, that we need to have specific quality policies and objectives. Unless we write down simple thing, when a patient comes to OPD, what will be my timing of OPD? How will I greet the patient? What will be the charges I will collect from the patient? When will collect? Who will collect? These simple, small things we need to take care of by writing. So if we spend, I think those who are already running hospitals, they may be understanding, or they might have written, but since I didn't write the policies and objectives, now with the running hospital, I find it very difficult. But those who are coming with new hospitals can spend 15 days. I think in 15 days, you can finish writing your policies with the help of all the technology. And then you can determine what are the activities necessary to achieve these quality policies and objectives. What happens at my hospital, we don't have written policies and objectives. And then also, because of the time limit, when a newcomer comes, new staff enters, we don't take the training. And since we don't take the training, then some problem happens, and then we get angry, or we may not show the anger, but we feel depressed that things are not going accordingly. And then the staff who has left us, or the senior staff, is blamed for not training the juniors. So all this won't happen if we have all the policies and objectives and the activities to be done accordingly at hand and ready to refer. And then organization-wide integration of the activities. Usually the hospitals are like couple-run hospitals, but everyone is so busy that some policies and activities are just decided, but they are not followed. And again, previously it was like this, that one person will do many tasks, whether trained or untrained. So clear personnel assignments is also necessary for a smoother functioning. Sometimes we can do the cost saving by multitasking, but we really have to be very clear about it. Specific vendor control activities through quality equipment identification. Yeah, quality equipment is very important. Otherwise, there is such a uh, big hue and cry in the atmosphere that we are easily deceived by equipment vendors. And I'm happy that Pranav and Amit are helping everyone in equipment purchasing also, guiding, at least guiding, I would say, and defined and effective quality information flow processing and control. I think this is regarding the software. So software is also very important. We must take the advantage of the latest technology. So what is the need for quality evaluation? Once our policies are in place, we need to evaluate whether our services, whether we are going according to our policies and delivering best of the services. Because of the assessment, we can maintain the quality, improve the quality, and ensure patient and public safety. Patient and public safety. Recently, there in Delhi, there was a fire in a children hospital, and 7 children died. So, public safety and patient safety is important. I don't know. I'm not commenting whether the doctor was at fault or the government or whoever. But what I'm saying, some basic things we must do, like fire installations and fire NOC, obtaining fire NOC. So recently there was a post on fire, understanding the concept of fire and how to avail the fire NOC in the because with each city, I think which each city, the interpretation of the rules of fire safety by the authorities is different, and hence charges are also different, and there is a total chaos. Like, we don't understand what I should have, what is costly, what is unnecessary, and what is a real safety measure. But in this chaos, we need to find our way uh, by taking the guidance from such posts, and local IMA also is helping. National IMA is also helping according to my perspective. So ensuring that patients are safe is very important. And for that, we need to work on at every level. We do work on our skills. We really take our education very sincerely. We really try to acquire skills. Whatever is not taught in our curriculum, we go attend, we spend on it, we spend money, spend time, energy, everything, and make ourselves very skillful. But along with that, we also need to think of our facility and its safety, and our staff and staff training, updation. Legal recognition, establish entry level requirements and legal recognition. So we must avail all the statutory compliances. There is no shortcut to statutory compliances, and day by day, see, we'll go towards NABH. NABH is voluntary till now, but all the clauses, all the standards in the NABH are gradually are imposed compulsorily, at least here in Maharashtra, by the corporation. So gradually, even fire was not there when I started the hospital. We never knew this word, that fire safety instruments should be installed and all these things. So then there was no biomedical waste. बायोमेडिकल वेस्ट नाम की कोई चीज यहाँ पे थी नहीं. रास्ते पे कितनी बार तो भी चौक में पूरा हॉस्पिटल वेस्ट पड़ा हुआ मिलता था. कई बार तो एबॉर्टसेस भी मिलते थे, दो दे वर नॉट फ्रॉम माय हॉस्पिटल ऑब्वियसली, बट मिलते थे और ऐसे चर्चे पेपर में आते थे. सो बायोमेडिकल वेस्ट नाम की कोई चीज नहीं थी. और आई थिंक ये भी नहीं था. और अभी nowadays lately I couldn't prepare well for this lecture because I was busy. As corporation has demanded, corporation is going all digital. It is it is ABDM, Ayushman Bharat Digital Mission. So for Ayushman Bharat Digital Mission, they asked for such a big data from us for the last year, 2023, April till March 23. They even asked for how many kg of yellow bag biomedical waste you have thrown. Thank God, lately we are keeping a very good record. Whatever orders are given by corporation, we are following it. So I could finish it in 7 days, but there are people who could finish in 2 days. But thanks to my staff also that I could finish it. But that much things are required. So all the legal recognition, even they in that data which they wanted, even the facility details were also asked, and that included all the legal recognitions. So everything legal recognitions we must obtain and we must keep handy. Like we don't want ourselves to get disturbed while we are examining the patient, giving our services to the patient, but we are disturbed by the corporation people or by the statutory compliances, old statutory compliances. So this was my like very sincere, I may call it as appeal, that you all please look into it and complete your statutory requirements. Those who are new beginners will do it for sure, but those who are running the hospital already also have to complete this. Verify that design or maintenance specifications are met. If you are building a new hospital, then minimum things, I will not talk of the show, pomp and show and everything, but at least minimally whatever is necessary, like zones in the operation theater, how OPD should be placed. Like we forget all these details while because see, we don't get architects who are expert in hospital planning. We sometimes we get, but we cannot afford them, and then we are really we go by the advice of the architects who are planning houses, or who are planning residential buildings, or who are planning commercial buildings, shops, etc. And then it's not in their capacity to suggest us, and then we make lot of mistakes which are not repairable later on, and or maybe the repairs are very costly. So it is good to design. Just by basic designing we must go for hospital designing, and maintenance is a big headache, so we must have a maintenance department in place. Department can only be one person who is sitting or who knows whom to call when, because as soon as see, now it's May end and June beginning, so now I know that electric supply will go off and on frequently. Same thing happened in April beginning, because that time also it was raining here in Maharashtra. So simple electricity or drainage or all these water supply, so many things needs to be managed. If we don't have a maintenance person, then it's a big headache leaving our OPD, leaving our operations and managing this. Document special capability as an organization or healthcare professional. For risk management also same thing. We have to work for everything, all types of risk. That is what NABH is expecting. That is code blue, code red, code pink. All these codes we must know, we must have a drill, and we must manage the risk. Implementation of new delivery settings. We must go for technology, and I think I need not talk on new technology, because what Doctorpreneur Academy is giving us is beyond imagination. They are almost day in and day out, they are hammering a new technology for us, and really some things really I wouldn't have heard if I wouldn't have joined Doctorpreneur Academy. It's that way. Address national public health issues. Yes, it's coming up in a big way. Tuberculosis, then Janani Suraksha Yojana, they are, or even Ayushman Bharat. We will have to work. Every person in India will now get a ABHA card, and we must be compliant with that. So all public health issues we need to be aware of, and reporting of the public health issues. We saw in Corona that it becomes a big public health issue, and then we have to participate with the government. At the same time, I really know, and I am really I think passing through it, that resources are very limited, and we have to use them very skillfully and very to the point, so that whatever is required, whatever we want, we can avail, and we become the great example of delivering the quality healthcare services. That's why we need to allocate our limited resources and dream for creating a center of excellence and formation of new systems or network of services. So my mother used to say, dream big, not failure, but not trying is a sin. So when the need for assessment of the quality control is, when it was felt, then came the hospital accreditation. So what is hospital accreditation? It is a process of creating collective organizational commitment of quality improvement, organizational analysis and self-assessment, strategic formulation of the organizational developmental planning, human resource development, teamwork and service systems focusing on patient-oriented mindedness. So for all this, we need hospital accreditation. And then for hospital, like how ISO accreditation came into existence, ISO 9000 standards approach was useful to consider in designing quality control systems for certain healthcare production services, such as laboratory, radiology, and food services. Industrial standards to facilitate international coordination and unification of standards. So these were the for factory products, but then they were applied into the healthcare industry. So
Jiti, आप unmute कर लीजिए.
Okay. So then came JCIA, Joint Commission of International Accreditation, accrediting healthcare organization in US. The Joint Commission of Accreditation of Healthcare Organization initiated the development of an international accreditation program in 1998. Yes, international, because in India there is a big flow of international patients. So international accreditation is also of great importance, and it was fully implemented in late 1999. The JCIS IA standards organized according to either patient care functions or management functions. So in India, there is NABH. NABH is a very standard body. It is a member of International Steering Committee of WHO, institutional member and member of Accreditation Council of the International Society for Quality and Healthcare. It is also a founder member of proposed Asian Society for Quality in Healthcare, which is registered in Malaysia, and it is a collaborating center for patient safety as a nominee of ISQUA Accreditation Council. So NABH has quality initiative in India. Quality assurance in healthcare in India was initiated at the Academy of Hospital Administration for the first time. And then came the National Accreditation Board for Hospitals and Healthcare Providers. Because for India, for small healthcare organizations like hospitals like us, ours, we can just aim for entry level NABH accreditation or certification. There is a difference between accreditation and certification, which our module is explaining very well. I don't want to go in that, but we must aim at least for entry level organization, because if we go for complete NABH, then there are lot of some 600 standards are there which we need to observe, and we need to comply with all those 600 standards, more than 600. But with entry level, there are only, I think, 108 standards. So 108 standards, they are very easy, and we get a lot of help also. But what I'm saying, if we form our own policies, while forming the policies, if we take reference of the NABH questionnaire, the 10 chapters in NABH, like care of patients, then hospital infections, and then staff human resource module, all those modules are there in the NABH. And accordingly, if we write down our policies and then work on it, then we need not get any help. We need not avail any help to get NABH accreditation. We need help for uploading the information and all those things. I don't know whether I should discuss this here or not, but what is my experience, that lot of companies are coming forward to help us in getting NABH accreditation, but it's not real quality control in its real sense, because it's only for time being that they adjust the things. They don't work on our quality control. We ourselves have to work on our quality control. For the first time when we are going for NABH, we should study on our own, and we should formulate our own policies for the first time. Let us take steps for farming, then for working accordingly, and then after we get the accreditation or certification, we forget about it. We don't continue it. So it's better that we continue and work according to NABH objectives. It is not difficult if it becomes a habit. And for NABH, everything is documentation. There is only one sentence which is true for NABH. Do whatever, document whatever you have done. And if you have not documented anything, that means you have not done it. So it's better to document everything. Once we document everything, and once we form a habit of documenting, train our staff and train our staff for all these things, it just becomes habit. And they are very simple to follow rules. Maybe a few things are difficult to manage, like lot of staff, trained staff, and their payments, their salary expectations. That is a big issue. But once we go with the norms and follow the norms, then our working also becomes simple, and we can concentrate on our practice, our patients and patient care. And of course marketing also, because that is also one of the necessary thing, though NABH doesn't deal with marketing of the hospital. But then once our brain is free of all these small things which are bothering us, then only we can think of good marketing and good activities to make our hospital noticeable by the public and to achieve that benchmark which we are dreaming. So enhancing health system and promoting continuous quality improvement and patient safety. It provides accreditation to hospitals in a non-discriminatory manner, regardless of their ownership, legal status, size, and degree of it. Size is very important, because that time, like, we used to really worry, I only have 15 beds, I only have 30 beds, so will I get? And like even the competitors, they do what? No, they have big hospitals, supposing 50-bed hospital, they get NABH accreditation, they get empanelment, and then we keep wondering why I am not getting. And then the message is also spread amongst us only. We only deliver such messages that small hospitals cannot get. But remember that irrespective of the size, we can get the accreditation. So this accreditation, they take, the survey goes this way. They take leadership interviews, clinical and support staff interviews, patient and family interviews. Patient and family interview, I'm not seeing them taking, but they do ask us for the feedback from patients and family. They want in writing that what is the patient and family feedback was given, have you collected? So we need to train our staff, we need to keep one staff ready to avail the this thing. If we ourselves are not aware of collecting the feedback or collecting the comments, then how will we teach the patient? At least I was not aware of collecting the comments. We, like, usually gynecologists get lot of pedas, and lot of people come and touch your feet, but then we don't collect in writing. So what will we show to them? So observation of patient care and services provided. This is through all the papers. So our paper writing should be very, the indoor case papers and OPD papers, everything should be very well written and very well maintained. Then they take the building tour and observation of patient care areas, building facilities, equipment management. So I just wanted to talk to you about, like, we forget to look after the departments, like yeah, give me 1 second. Like, we forget housekeeping department, laundry management also. We just have one ayabai and then we leave everything to her, because she washes clothes at home, at her own home. So like, like that she will manage. That's what our thinking is, and we don't have time to go to the back door and see what is happening with the laundry department. Similarly, mechanical department for maintenance of all our equipments and all other like electricity and all such gadgets which we are using. So mechanical and maintenance department, those two departments. I am not talking of big departments or big offices and lot of staff, but at least we must know who can handle it properly and where to look for when it fails. Similarly, hospital waste management department. Once we make the norms, once the system is in place, we just don't have to look after the biomedical waste thing. I don't know what is happening in other cities, but in our city, only one agency is there who collects the biomedical waste from all the hospitals, and accordingly, they train us. They keep sending us letters also, and accordingly we have to train our staff and collect the biomedical waste, measure it and give it to them. That really makes it look very tidy and very clean and organized. So we do have to look after the this biomedical waste department. Just one bathroom like space where all types of bins are kept, and then same colored bins are kept with us in OT, in all the areas like dressing areas, minor OT, labor room, everywhere, OPD, and we just have to collect the things accordingly. That becomes very easy also, and only one rule is followed in the hospital. Otherwise, one staff is throwing somewhere else, then some higher management is not aware of what to do, what is happening, and then it's all a mess. So we do have to look at that department. That is what I wanted to stress. I couldn't make a slide. That's why. Then central sterile supply department. This is the department which, like, they are autoclaving somewhere else, and then we are operating somewhere else, or we are not, like, एक गैस है, एक ड्रम है, एक ऑटोक्लेव है, उसमें ड्रम डाल दिया, हो गया. If we look after our sterile supply department, then what will happen? While establishing the department, it is costly, but as we go on, it is cost effective, it is cost saving also, for not only for we hospitals but also for the patients. Gradually these norms are also coming up. We will not be able to use antibiotics haphazardly. We'll have to give reason for using the antibiotic, and for that we need to be very careful, and we need to be very careful and manage our CSSB. Then pharmacy. I was not aware. I was in an impression that pharmacy, I should not go for pharmacy. If I go for pharmacy, the pharmacist will dominate me, and I was not aware of the second source of income pharmacy gives us. So we must, in Marathi they say, धन जोडून या उत्तम व्यवहार है. धन तो जोड़ना ही है हमको, पर सही व्यवहार करके. तो इसलिए फार्मेसी एक बहुत अच्छा रास्ता है धन जोड़ने के लिए. So that's what I wanted to stress, that we must have all these departments, policies and procedures. And for that, we need to orient our staff, train the staff, document, then sanction budget, and make quality assurance plans also. All this is examined by the NABH also. Then medical records are examined. If we have any specific achievement for the hospital, that also they take into account. And then they look after our immunization rates, hospital acquired infection rates, patient satisfaction through a review and discussion of monitoring and improvement. So, what are the advantages of such type of accreditations and certifications? So benefits of such benefits are to patients also, to the staff also, to the hospital also, and to the community also. For if we go after the accredit, but it has to be in its true sense. We have to follow the procedures of accreditation all throughout the years. Once we get the certificate and we stop following, then it's of no use for our improvement. We'll keep getting the certification and we'll keep getting the empanelment after the certification. And nowadays, IRDA has said that it is not necessary to have the NABH accreditation also. But for our quality improvement, we must follow. We may not go for NABH certification, but we must follow the processes and systems designed by NABH. Because there are a lot of benefits to the patients, like continuity of care and safe pain management and focus on patient safety, patient satisfaction, rights of patients, access to a qualified focused organization. Because if we follow the quality standards and we observe all the policies made for maintenance of quality, then gradually public comes to know, yes, this is the hospital who follows the qualities. This is one of the hospital who gives quality services. Once we achieve the standards and once we follow it, we keep updating ourselves, then automatically it becomes a cost control also automatically happens. And so we can also give affordable cost to the patients. Thus we get thus the patients feel that this is the hospital who has got credentials and the staff is trained and privileged to give such services. Then we become famous for high quality of care, and understandable education and communication is also the benefit for the patient. It also automatically, once we start following the processes, hospital processes, whatever policies we have designed, employees are also attracted, because there are a lot of employee benefits which improves professional staff development, provides education on consensus standards. It provides leadership for quality improvement within medicine and nursing department, increases satisfaction with continuous learning, good work environment, leadership and ownership. So that's how we start getting more employees also. So we must stick to the quality control policies. Policies can vary. Whatever is in our, like we cannot say that all these policies, they work in the big factories and big institutes, corporate hospital ka culture yahan kahan la rahe. It's not that way. We don't have to copy them. Whatever is in our control, whatever is required for our existence, we must have the policies in place, the processes in place, and we must follow, train the staff for that, and follow, assess, reassess, update. So that is the only thing. So what are the benefits for the hospital? It improves care, stimulates continuous improvement, demonstrates commitment to quality care, raises community confidence. Yes, community automatically puts the confidence in us, and that's how we we can generate more revenue. And it's an opportunity to benchmark with the best. There are benefits to the community also, quality revolution, disaster preparedness, epidemics, access to comparative database. Epidemics we saw in COVID. Thank you. That was my sharing. I am not sure whether it was complete or something, because I am talking on this type of subject for the first time. Thank you so much.